Welcome to Grow Them Right, podcast where we discuss how to prevent health issues from infancy. I'm Dr. Roche, a dentist and a mother of two. As a dentist, my expertise are in oral health, and I'm committed to continuing education. I also have a keen interest in preventative health. So in this podcast, I ask questions of experts, explore their insights, and discuss practical tips on how we can help our children grow healthy and strong right from the start. The whole idea for this podcast is to elevate the conversation and allow you, the listener, to make more informed decisions. I need to emphasize that these podcasts are not a substitute for medical advice. If you have any specific health concerns for you or your loved ones, please speak to your own medical professionals. I hope you find this space useful. And if you do, please take a second to subscribe and share with your friends. And together, let's grow them right. Hi everyone, and welcome to the podcast. Today is my honor to have Dr. James Muecke with me. Dr. Muecke is an Australian ophthalmologist and the 2020 Australian of the Year. He is renowned for his work in preventing blindness and advocating for public health initiatives, particularly focusing on diabetes-related eye disease. He founded Sight for All, a non-profit organization dedicated to fighting blindness in developing countries. James, welcome to the program.
Thank you, Roche.
Really appreciate your time today.
Great to be here.
So you're an ophthalmologist,
Yes.
but you have been talking and focusing on metabolic health,
Yes.
diet, and its impact on health. What sparked your interest on this topic?
Well, really for, I think, 35 years now, I've been in the ophthalmic world. And for that entire duration, I've been dealing with the blinding consequences of diabetes. All types of diabetes, type 1, which makes up about 10% of cases, and type 2, which makes up close to 90% of cases. And what I've noticed over the last 30 odd years is the rise in type 2 diabetes, also the rise in patients who are losing vision, even going blind due to their diabetes. So it troubles me. It troubles me that, firstly, people should not be losing vision going blind due to diabetes. Full stop. They should be having their eyes checked on a regular basis, and we should be avoiding that complication, the most feared complication of diabetes. But more importantly, majority of cases, as I mentioned, were due to type 2 diabetes. This is a largely avoidable man-made dietary disease we should not be seeing at all. It was rare back in the 60s, and now seeing about 250 new cases developing in this country every day. Amounts to about 100,000 new cases in this country every single year. Back in 2018, I wanted to understand more deeply the experience of blindness. So I interviewed 10 people for a documentary that I wanted to create for children that had been born blind, and they had fascinating stories. For people who were slowly going blind at the end of their lives, primarily due to macular degeneration, and they were coping very well with their loss of vision, and was mainly the loss of independence, which was a problem for them. But the two people who really had powerful stories were two people in the prime of their lives who lost their vision due to their diabetes. And one in particular, a man named Neil Hansel, he's quite happy for me to use his name, a guy called Neil Hansel who went to bed at the age of 50 with normal sight and woke up the next morning blind in both eyes. And the story was harrowing, and it really made me sit up and think, firstly, we need to encourage people to have their eyes checked. Of the 2 million people in this country with type 2 diabetes, well over half are not having the regular, all-important sight-saving eye check. That's why it's become now the leading cause of blindness amongst working-age adults in this country.
So this podcast is Grow Them Right. You focus on children. Metabolic health and type 2 diabetes is on the rise in children as well, in the pediatric population. When do you think parents should become aware of children's diet? Are there any early signs that parents can become aware of when it comes to, how children are traveling on that trajectory?
Well, we have an obesity and type 2 diabetes epidemic in our kids. A quarter of our kids are overweight or obese now, and we're seeing type 2 diabetes in kids in this country as young as 3. When I was in medical school, this was known as maturity onset diabetes. But Northern Australia now leads the world for diabetes amongst young children.
It's heartbreaking.
It is heartbreaking, absolutely heartbreaking. And what we should be doing is educating people about their dietary choices from the earliest years. But with the rise of what we call gestational diabetes in our society, we're priming kids for a range of metabolic and mental health disorders before they're even born. So the education needs to begin even earlier during pregnancy so that we can avoid these serious metabolic dysfunctions in our kids.
And the data is that 1 in 6 women is now afflicted with gestational diabetes.
It's troubling, isn't it?
At the moment it is.
And with gestational diabetes, glucose passes across the blood-fetal barrier, but insulin does not. So we're priming these kids for metabolic dysfunction. That's why we're seeing this epidemic in our kids. So
the fetus already is overwhelmed with the amount of glucose that it has in the blood already.
Exactly.
But it's very confusing as young parents. I mean, I'm a mother of 2, and my kids are now, almost adults and very healthy. But the issue was that we don't know what we're doing. We don't know whether we're doing the right thing or not. You read one study and says one thing, and another study says another, and we don't know whether what we are doing is actually good for our kids or not. Now, when it comes to sugar, that mixed messaging seems to be there as well. Is sugar bad? Isn't a bit of sugar good for you? Isn't sugar brain food?
Well, there are now over 8,600 studies linking sugar to a range of chronic diseases, type 2 diabetes just being one of them, something like 54 different adverse health outcomes. There's no question sugar is a toxin. And I came up with this concept of the 5 A's of sugar toxicity a few years ago when I was thinking more deeply about this. Firstly, A, sugar is addictive. It's highly addictive. It's been shown to be as addictive as nicotine. Its consumption activates the reward center in our brains, leading to the release of the neurotransmitter dopamine. It makes us
happy.
Makes us feel good. What makes us want to do it again, and it ultimately what gives us those cravings. So, like drugs, it becomes a vicious cycle that's really hard to break if we try and drop it. The second A is accessibility. Sugar is cheap, and sugar is absolutely everywhere in our lives these days. I'm sure you're aware of that. You can't walk into the service station without being confronted by a wall of confectionery. You can't check out from most supermarkets and stores, even chemists these days, without being enticed by half-price chocolates and soft drinks. It's really troubling. Third A is addition. An astronomical amount of sugar is added to our food and drinks, something in the order of 75%.
Wow.
The fourth A is alleviation. We often use sugar to alleviate stress or to make us feel better when we're down.
Yes.
When we're stressed, the body is flooded with the stress hormone cortisol, amongst other things. And so the brain needs to balance this out by releasing the feel-good chemicals such as dopamine. And as I've showed you, sugar is a great trigger of that.
Yes.
And the final A is advertising. Our world is flooded with ads and sugary products everywhere. TV, bus stops, you name it. Everywhere we go, we see ads for sugary products. So it's very hard to escape. And this is why it's so difficult for parents to, even if they want to avoid this, become normalized in our society.
Yes.
And if we look at the critical foods which have so much added sugar, it's what we call ultra-processed foods.
Yes.
In the United States, it makes up 62% of the calories in the diet. In the UK, it's over 50%. And I suspect here in Australia, it's probably close to 50%. And these products are packed with sugar, often, not always, but they're often packed with sugar. They're also packed with refined carbohydrates, often in the form of wheat flour, which is highly refined. And basically, it's just pure starch. And all starch is a long chains of glucose molecules which break down into single glucose molecules as soon as they enter the body. As you know, with salivary amylase, as soon as they enter the mouth.
Yes.
And the third element, which is potentially toxic to us, is the seed oils, what we euphemistically call vegetable oils, but they're made from seeds such as canola, safflower, sunflower. And these three things are the major components of most ultra-processed foods. So when you're consuming ultra-processed foods in abundance, it's pretty much like a loaded gun pointing directly at your livers, causing metabolic dysfunction. And it's important to realize that glucose, refined carbohydrates are nutrient poor and non-essential. There's not a single biochemical process in our bodies that demands we consume them.
Mm-hmm.
We can actually get all of the energy we need from the proteins and healthy fats in our diet.
Mm-hmm.
And yet, as I mentioned, this has become such a huge part of our lives.
It has.
So much so that consuming ultra-processed foods is normalized.
That's right. And because we have this disconnect of children to the family, children are probably more, especially when it comes to teenagers, they're more connected to the media through their phones than they are to their parents. So their influence and their information comes from a source that is probably not, doesn't have their best interest at heart.
Absolutely.
It has the best interest of their pockets, their money. And so I remember this challenge, and probably to a degree I still have this challenge that, I felt that I'm swimming against the stream. And as much as I wanted to bring about a community of parents that think alike, it was always difficult because, give the Easter eggs and, your children need to be happy. And so I think that is the challenge. And I wonder, what is the role of the school, the community, the government in giving a bit of a helping hand to parents, the young parents, in wanting to do the right thing by their children? Because I think a lot of things that you have mentioned, a lot of people know this. A lot of people know that processed food is not good for their children or sugar is not good. But we succumb to that demand at the end of the day because the pressure becomes so much. What do you think is the solution?
Convenience factor as well.
Right.
So convenient just to pack your school lunches with a bunch of ultra-processed products. You don't have to think too hard about it. You don't have to spend that time preparing, particularly if you're racing off to work. So it is a problem, particularly this convenience factor, which is so insidious. But we also have companies, businesses, entire industries which are preying on people's addictions. Most of us are addicted to sugar. I have no doubt about that. I certainly was, and I think I probably still am addicted to sugar.
Yes.
It's very hard to escape, as I mentioned, it's a real problem. So the ultra-processed food industry, many of them of which are multinational companies, they're not Australian companies, but they're certainly Australian processed food companies, are preying on these addictions, particularly our addiction to sugar. And you'll notice again at supermarkets, as I mentioned before, the predatory marketing that goes on, the half-price confectionery at checkout counters, end of aisles. If you try and escape those middle aisles, often which are packed with ultra-processed products, if you just stick to the outer aisles, to the grocery section, we now see stands of chocolates in those sections of the supermarket. Right. So they're preying on us at every turn.
Yeah.
There are ads which are aimed at kids on TV during those hours when kids are watching, specifically aimed at kids.
Yes.
And also social media is rife with ads for sugary products. So it's so hard to escape. And as I mentioned before, it's become normalized, but at the expense of our children's health. So one of the biggest problems we have is our Australian dietary guidelines, which are a high carbohydrate eating recommendation. They are quite literally everywhere. I mean, most of us probably have not even heard of Australian dietary guidelines, but they dictate what's taught at schools, what cooks prepare for people in childcare, all the way through to aged care. Also what's cooked in prisons, the Defence Force, hospitals. So there's this recommendation that we should be eating this high carbohydrate dietary pattern. The guidelines suggest that they're only for healthy Australians, but the reality is the majority of Australians are not healthy. As I mentioned, 2/3 of Australian adults are overweight or obese. 1/4 of our kids are overweight or obese. So these guidelines are not appropriate for most of us. So the guidelines need to change, because until the guidelines change, various health bodies, public health bodies, schools continue to promote this high carbohydrate eating pattern. But if you realize, if the majority of us are not healthy, if we're metabolically not healthy, it means that we are most likely insulin resistant, which is the core metabolic dysfunction. If you're insulin resistant, then you are intolerant of glucose. You cannot handle the glucose load coming into the body. And by default, you're also intolerant of carbohydrates, which basically most of them break down to produce glucose.
And that's often advertised as healthy food. You know, the breakfast food is often those simple carbs that people are giving to their children, you know, the cereals, plus a juice, plus a piece of toast with jam, you know, so you've already overloaded fruit and fruit juices. And you've already overloaded that little liver with an avalanche of glucose, which they have to process, but they probably, you know, hit a slump at, 10:30, 11, and they want to repeat that whole process.
Exactly.
Do you find that is the norm at the moment?
Yeah, absolutely. And this adage, breakfast is the most important meal of the day, that was popularized by John Harvey Kellogg back in 1906 to market his newly invented breakfast cereal, Kellogg's Cornflakes. But there's really no evidence whatsoever to say that we must have cereal for brekkie. In fact, most of us will do better without having cereal for brekkie because, as you rightly suggested, what happens, you get this huge burst of glucose in the bloodstream. And it just shows you when glucose enters the bloodstream, the body goes to great lengths to remove that almost immediately. So the pancreas releases insulin. The insulin helps move the glucose into every cell of our body, where it's either used as an energy source or stored. So then what happens when this insulin suddenly spikes on the back of the glucose spike, you have a crash of glucose in the blood, and you actually become hypoglycemic, a low blood sugar. You
get the shakes.
Yeah, and that by mid-morning, most kids are needing that sugar hit again, and that's why morning tea, they often have another sugar hit, and it goes on like this roller coaster, which makes it very hard for kids to actually concentrate in the classroom.
That's right.
And for teachers to be able to manage them.
You've been tireless in your advocacy for, informing these guidelines and probably, hopefully, gaining some flexibility in the authorities to listen to you. How much luck have you had in that? Do you think that the industry is changing or the governments are starting to take note?
Let's hope so, Rosh. It's now been over 10 years since the Australian Dietary Guidelines, the current draft, was published, so 2013. They're currently reviewing the Australian Dietary Guidelines, and that won't be released probably till 2026. So we still have a few more years. And as I mentioned, this continued growth of type 2 diabetes in our society. And type 2 diabetes is really just the end stage of the most severe expression of metabolic dysfunction. So we're going to continue to see this rise across children into adults if we don't do anything about it. One of my main concerns about the Australian Dietary Guidelines is it certainly doesn't promote the consumption of junk food, what they call discretionary food.
Yes.
That's a good thing.
Yes.
But what it does do, it encourages the consumption of seed oils and margarines, which have been linked now to multiple chronic diseases, including type 2 diabetes. And it continues to discourage the consumption of natural saturated fats, such as found in butter, eggs, full cream dairy, red meat. And yet, there's no strong evidence whatsoever to link the consumption of saturated fatty acids to cardiovascular disease and type 2 diabetes. And yet, it's still what we hear more than anything, that saturated fat is bad for us. There's no strong evidence whatsoever to link these really critical health issues to what we consume in the form of natural, real foods, whole foods.
Such an important topic because the burden on the health system is staggering, isn't it? I mean, I was just looking at the data, and 1 million hospitalizations in 2021 due to metabolic issues. So it's a very good cause. But I always have this sympathy with parents, with young parents, because they are at a loss. Every topic that you put your hand on, we don't know whether we are tough enough on children or we are too tough on children, and we really don't know what to do. But there are some things that we really need to be firm as part of this parenting journey that we have. We need to set these boundaries, and probably, saying no to bad food is one thing that is probably the most important element. Grow them right means that we want to future-proof our children so that when they're 30, they're not grappling with disease. When they're 40, they're not, hospitalized. Blindness is a very interesting one, and it's your work, basically. Are you seeing results of metabolic health affecting eye health in children at this point, or is it still rare?
So I mentioned that there's an epidemic of type 2 diabetes in children, but it's still rare, fortunately. We are seeing it in kids, but it's still rare. And it takes some years to develop the complications of type 2 diabetes. So to see the blinding and vision-threatening complications of diabetes in kids, I myself haven't seen it. Mm-hmm. It's certainly been reported, but I haven't seen it, which is good. In fact, I rarely see kids with type 2 diabetes. It's very, very unusual, but it's certainly a problem. Fortunately, the blinding complications are rare in kids, but as soon as a patient develops type 2 diabetes, that diagnosis is made when the HbA1c rises above 6.5. We don't know how long that patient has had type 2 diabetes. They may have had it for some years. I've even seen retinal disease, the retinal complications, the blinding complications in patients with pre-diabetes.
Wow.
So we don't know how long that patient has had the disease. There's something like, I mentioned, 2 million people in this country with type 2 diabetes, about 1.3 that we know of, probably another 700,000 plus that we don't know of that are in the community with type 2 diabetes, developing these ongoing complications. And the blinding complications, the most feared complication, is just one of a whole body full of complications that can develop. So we don't know how long it's been there, so we need to check their eyes literally on diagnosis. Type 1 is different because it takes some years, and that's an acute disease which is completely unrelated to type 2 diabetes. It's due to autoimmune damage to the pancreas, most likely following a viral infection. But we need to check the eyes of patients as soon as their eyes their disease is diagnosed. If there's no sign of retinal disease, every couple of years should be fine. If there is retinal disease, it depends whether it's imminently vision-threatening. If it is, we might need to start them on treatment straight away, or we might need to review the patients every 3 or 4 months. If not, probably just on a yearly basis. And it's important to pick up those vision-threatening complications as soon as we can, because we know that something like 98% of the loss of vision and blindness due to diabetes is preventable or treatable. So we want to be seeing every single one of those patients as soon as they develop the disease and on a regular basis for the rest of their lives. But what's amazing is that we know that type 2 diabetes can, in patients, some patients, not all unfortunately, be put to remission. It can be reversed.
And that's a very interesting point. Is type 2 diabetes curable? I mean, that's a very highly debated topic, isn't it?
I think we shouldn't look at a cure as the end game here. And you can debate whether we should call it remission or reversal of type 2 diabetes, but there's no question we can actually improve patients' metabolic function using real food as medicine. Until 2021, the very first sentence in Diabetes Australia type 2 diabetes webpage was type 2 diabetes is a progressive disease.
Yes.
So me, as a doctor, that was my understanding. This was a progressive disease. Ultimately, patients will need to be on medications and ultimately insulin, and they will develop a raft of complications and ultimately potentially die of their disease.
Progressive disease means that gradually it gets worse and worse, and it's not reversible. It's basically going to go on that trajectory. And that's what the doctors believed.
That's what the doctors, and most doctors still believe. The vast majority of doctors and their patients with metabolic dysfunction think that this is a progressive disease. Now, in 2020, in my desire to understand more deeply what's happening with type 2 diabetes, I read widely, and there are a number of very powerful books that had a big influence on me. One of them was Jason Fung's The Diabetes Code. And I found out from Jason's book that type 2 diabetes could be reversed naturally using food. In 2020, I was put on the National Diabetes Strategy Expert Advisory Group, and I managed to get remission in that document for the first time ever. And this was amongst an advisory group of probably close to 30 experts. So it wasn't disputed, which is great. It's in there now. And on the back of that, I then started in 2021, when it was published, I started having the conversation with my patients. Did you realise that your type 2 diabetes could potentially be put into remission? Only 1%, one of perhaps the first 100 patients I spoke to, were aware that their disease could be put into remission. So I then wrote back to the GP saying, can we explore this amazing opportunity to put patients, our mutual patients' disease into remission? And the majority of those letters were ignored. But occasionally, some GPs, often pressured by the patient, started to engage in the process. And I recommended a nutritionist in Adelaide who specialises in dietary adjustments to potentially put patients' diabetes into remission. And then I started to see the outcomes, and it was quite staggering. I still remember the first patient that came back to me. He came off his insulin pretty quickly. He'd had type 2 diabetes for 10 years, came off his insulin pretty quickly. And then over the ensuing weeks to months, he came off all his medicines. He lost a bunch of weight. He said he's never felt better, but his eyes started improving as well.
It's incredible.
Which was amazing to me. And he was the first. And I had a whole bunch of patients now that have put their disease into remission. There was a middle-aged woman who came off her insulin within 2 weeks. This has been, for me,
that's so exciting,
the most extraordinary experience in my 40-year medical career.
So exciting.
It's super exciting. It's super exciting. And what I notice almost across the board, when patients change their diet, basically, as we mentioned before, type 2 diabetes is a disease of carbohydrate intolerance. Insulin resistance equals carbohydrate intolerance. So if you drop their carbohydrates, and we can talk a bit more detail about the physiology and biochemistry.
Yes.
Once you drop their carb intake, it allows potential remission of type 2 diabetes to happen. So I was seeing this in my patients, but almost across the board, as soon as they dropped their carb intake, we started seeing improvements in their eyes as well. So the commonest cause of vision loss in diabetes, type 2 and type 1, is a condition called macular edema. The macula is the central vision area of the retina, and you get damage to the fine blood vessels of the central vision area, leakage of fluid into the tissues of the central vision area.
It's an inflammatory process.
We can come back to that. But basically, what we noticed is the macular edema. What I was doing with patients who had vision-threatening macular edema is injecting into their eye on a regular basis an antibody called anti-VEGF, which sealed up those leaky blood vessels, hopefully allowing the swelling to subside or go completely in some cases. But unfortunately, it wasn't a one-off treatment. And most of these patients were on treatments for years. Quite literally, they were on these for years. And as soon as they dropped their carbohydrates, what we noticed is we were able to extend the interval between injections. And some patients were able to get off injections altogether. And the patient I mentioned, the very first patient, is now off his injections altogether.
Incredible.
But I then started exploring this with patients who could have required injections. But I thought, well, let's try the dietary change before they go down the injection pathway. And there's a patient who, the one I mentioned before, who came off her insulin within a couple of weeks. She, with this change in diet, we saw this reduction in her macular edema over the subsequent 9 months. Her macula has now normalised. And we're writing up this case report as we speak. It's just been accepted for publication. I think it's the first time it's ever been reported in the literature. So this is amazing. And I'm seeing this almost across the board. And I'm functioning within my own little silo of ophthalmology, seeing these vision-threatening and blinding complications. And as I mentioned before, there's a whole raft of complications. And what almost all of my colleagues as well, when they put their patients' type 2 diabetes into remission, also see improvement in many of the other complications as well. Unfortunately, sometimes when the diabetes has been very advanced, the vision-threatening retinal disease is too far advanced to be able to reverse it
meaningfully.
But certainly we can improve it.
Yes.
Of course, the major concern, vision loss is the most feared complication, but the major concern is death due to stroke or heart attack. So 80% of patients with type 2 diabetes will succumb to a heart attack or stroke. But to me, I think the most feared complication should be dementia. So something like 70% of patients will develop dementia. I lost both parents to dementia. So this is a disease that impacts hugely on the family. So if you can actually improve the patient's metabolic function, then all of these complications, we can delay it.
That's right, because it's one system. I mean, it's a very holistic look at this organism, which is the human body. You know, you mentioned, practicing medicine in silos, and I've always said that medicine is taught in silos. You know, you're an ophthalmologist, an orthodontist looks at teeth, and ENT looks at ears, but it's all connected. You know, one area is affecting something else. So this approach that you have to health, empowering the patient that yes, they have a role, primarily is, and for young parents, they are the drivers of this process. They are the main people that can impact the health of their children, not the system, not the doctors, but the parents. And when the children are at the age that they can take responsibility for their own health, and hopefully they have those habits from early childhood that, is second nature to them: exercise, fresh air, being connected to nature, eating healthy food, having a low sugar point that has, been given to them as a gift by the parents. All of that basically contributes to this trajectory that is going towards health rather than disease. But I think one of the most honorable things that health professionals can do is to eventually make themselves obsolete.
Exactly.
Isn't it?
Exactly. Well, that's what's happening to me. I'm now doing myself out of a job because I'm giving less injections, but it's so exciting to be able to demedicate patients with this huge load of patients with type 2 diabetes in our society. This is not going to happen anytime soon, so no one needs to worry about their careers getting threatened.
Yes, of course.
But certainly, ultimately, that's what we should be aiming to do. And
that's right, yes.
We are taught in medical school to medicate.
Yes.
We're not taught
to prevent.
And using food, real food, as medicine to prevent this metabolic dysfunction that underpins all of these chronic diseases. My son was in second year medical school a few years ago now, but he had the opportunity to use, to do as an elective nutrition science. It was an elective. This is the biggest killer by far. In fact, our poor diet is responsible for more disease and death than smoking, alcohol and physical inactivity combined. And yet it wasn't being taught, or it's not being taught in our major medical schools.
Yes.
So it's really disturbing.
Yes. And as you might know, my interest is airway health and how we grow the children's airways in the right way so that they've got more patent airways as they grow. And of course, sleep health is also related to our cravings for sugar and the metabolic dysfunction as well. So it is all interconnected. It is a big discussion. And I think probably the point of this podcast would be to empower young parents that yes, they have a say in this. They can do something. They can impact the health of their children, but also maybe they can also speak up. They can ask their GPs, their school community, their faith communities to become more aware of this issue and perhaps eventually change the way government policy is set.
Absolutely.
And as a last question, I asked you were the Australian of the Year 2020, and this last 4 years has seen you be even more active in your advocacy. What have you learned in the last 4 years?
What have I learned? Wow. Well, when I received it, I was lucky enough to receive the award of Australian of the Year back in early 2020. I wasn't expecting to win it. I did not expect to win it, but I had to be prepared. And I thought, well, okay, what's Australia's biggest health crisis? It's type 2 diabetes. Australian of the Year, doctor, surely this is a thing I should embrace. So I was certainly no expert in type 2 diabetes, but I read widely and deeply, and I really learnt a lot about type 2 diabetes. But I learnt so much. I mean, I don't even know where to start. But what I learnt was so powerful in this, not just for prevention, but also the ability to reverse the disease. Now, we haven't really talked about how to reverse the disease, but dropping our carb and sugar intake is one of them. But also the other big driver of metabolic dysfunction is the seed oils. So when I received the award and decided to use the platform to advocate for patients with type 2 diabetes, I read broadly. I met a lot of people who've been working in this space, and they became mentors to me and guided me, and it's been an extraordinary journey. The fact that we were able to get remission into the National Diabetes Strategy was a real turning point. And since that time, we've actually now written guidelines for what we call therapeutic carbohydrate reduction. So the guidelines have been written, and earlier this year they were endorsed by the Australian Diabetes Society and Diabetes Australia.
Wow.
So this is absolutely pivotal. We have our major bodies in Australia endorsing this opportunity, this incredible opportunity for patients. And on the back of that, we've now gone to medical schools, and many of the medical schools that we're talking to are embracing this opportunity and injecting it into the curricula.
Wow.
We've just written a 10-module course. This is done in conjunction with the Australasian Metabolic Health Society. We just written this 10-module course for dietitians. So Dietitians Australia have taken this on. And the dietitians group, there are over 7, I think probably close to 8,000 dietitians across the country. And if we have this very powerful and important group offering this opportunity to patients, it's going to be instrumental in turning around our chronic disease epidemic. So it's a super exciting time, and the final piece of the puzzle is to get the GPs on board, because, as I mentioned, most of the GPs don't know this.
Yes.
So we're actually going out through Peter Bruckner's group, Defeat Diabetes, to the GP, College of GPs, to hopefully inject this into their postgraduate program as well.
Amazing. On behalf of the audience and myself, I thank you for all the work that you have done. What a treasure for Australia, and your recognition in 2020 was so well deserved. Thank you so much for your time today.
Thanks so much, Rosh. I really appreciate the opportunity to be here on your podcast, and congratulations on everything you're doing to promote health, particularly in our youngest and dearest.
Thank you so much.